This video will be about aseptic technique, aseptic non-touch technique, sterile compounding on patient units. Our objectives: to identify key parts, step-by-step guide for aseptic non-touch technique, wrong practice that shall be avoided. Key parts. It's a part of equipment that must remain sterile as it comes into direct or indirect contact with the liquid infusion. For the vial, the key part is the septum, which is the rubber component of the vial. For the ampule, the neck part is the key part of the ampule. For the needle, all parts of the needle are key parts. For the syringe, the needle is key part, the tip is key part, the plunger is key part. Any touch for the plunger or any other key parts will introduce contamination inside the preparation. Okay, that's why it should be avoided. For the bag, the key part is the injection port or the administration port. Before you start preparation, you shall review the standard concentration guideline and the maximum concentration guideline. You will find in the internal website policy number PHD 008. Go to internal website, select policy and procedure, then log in, then select the policy, the intravenous medication preparation at Word, then you will go to the attachment at the end of the policy. Let's talk about step-by-step guide for aseptic non-touch technique. First step, you should clean your hand using antiseptic soap. Cleaning hands usually take from 45 to 60 seconds to be done. After you finish hand washing, you will clean the tray from inside to outside using a gauze wiped with alcohol 70%. As you see, the cleaning should be from inside first, then outside part. After this, leave the tray and allow the alcohol to dry. You will go to collect all containers and check the expiry, check if any discoloration, if any particles for the medication, for the bags, before preparation. Then collect all needed equipment, syringes, needle, vials, all needed equipment for the preparation. Then you will scrub your hands with sterile alcohol 70%. The same steps for hand washing. Then you will put on non-sterile gloves. It's better if you have sterile gloves. If you don't have, you can use non-sterile gloves. Then you will add all needed equipment after wiping with alcohol in the tray to be ready for the preparation. After you finish cleaning, you should change your gloves before starting the preparation. Then uncap vials and bag. Then using alcohol swab, you should wipe each critical part of each equipment with this alcohol swab 3 times in the same direction, and very important to allow to dry. Remove the syringe from the package without touching the critical parts, the tip, the needle. Then remove the liquid to dissolve the powder, also keeping the needle without any touch. Also plunger, don't touch the plunger while you withdraw. Then using non-coring technique, by 45-degree insertion of the needle into the septum, then dissolve the powder, then try to withdraw the dissolved or reconstituted solution, and make sure that the needle is down to the neck of the vial to make sure it will take all the volume. Also, while you withdraw, avoid touching the plunger. Make sure the needle is on the level of the neck. Then transfer the liquid to the injection port of the bag. Then cap using scope method. If you have sharp container, you should discard sharp in the sharp container. Then you will stick the label with all information on the bag. If you have glass ampule, you should use filter needle, which filter any glass particles that can be present inside the ampule while you open the ampule from ampule neck. It's important to discard any sharp items in the sharp container. See, there is a point on the neck of the ampule. You can use this point to open the ampule. Then discard in the sharp container. Then withdraw with the needle attached, with the syringe attached to the filter needle. Then try to make the ampule in an angle, like 45 angle, to make sure all liquid is down and you can withdraw all the volume. Then after you withdraw, you will discard the ampule. Also, you should change the needle, the filter needle, with a regular needle. Then after you adjust the volume you want, you will transfer to the bag. Also, use scope method to cap, then discard sharp items in sharp container. Then you should stick the label on the side of the bag which does not contain the information of the product. Then change your gloves after preparation. You'll discard in a medical waste. Then alcohol rub your hand with sterile alcohol 70%. Then put on again new gloves. When you receive a bag prepared from pharmacy, take care that there is an open port, which is the injection port, and there is unopened port or capped port. This is the administration port. You should use the administration port for administration of the medication to the patient. Clean the administration port first, 3 times in the same direction using alcohol swab. Return back to steps of preparation. You should clean key parts of the patient IV access using alcohol swab with chlorhexidine. Always avoid touching any critical parts. After you finish, you should dispose all sharp equipment in the sharp container and any gloves or non-sharp equipment in the regular medical waste. After you finish, you should clean again your tray, dispose your gloves, and scrub your hands using sterile alcohol 70%. The following practice should be avoided during the procedure. If you wear a ring, you should remove it before hand washing. Don't use alcohol wipes for cleaning the tray. If you open the syringe, don't let the syringe fall down on the tray. Handle with caution. Don't use the syringe to withdraw directly from the plastic ampule. You should withdraw using only the needle of the syringe without touching the needle. Don't allow the needle to touch any object. Take care. This is one of the wrong practices that shall be avoided. Don't touch the plunger of the needle while you withdraw any liquid or any medication from vial or from ampule. Don't touch any critical part. Filters used for administration of TPN. We have 0.2 micrometer filter for TPN bag, and we have 1.2 micrometer filter for lipid administration.